Arthritis is a very common disease affecting joints and bones in most people in the United States and throughout the world. The spine itself and the vertebral bodies of the spine are no exception to arthritis. Arthritis typically affects the little joints in the vertebral bones. So again, this is the posterior view of an individual. So this individual's tailbone is right here, and this yellow structure is actually the spinal cord. Now the spinal cord is protected by all these bones. These bones run all the way from the tailbone to the top of the head and the back of the neck. And these are vertebral segments that are stacked one on top of another to protect the spinal cord. Now in order to allow individuals to move, there are little joints in the back. And these little joints are called facet joints. Now, as individuals age, and typically due to genetics, these little joints can have arthritis. Now, the interesting thing about these facet joints, these joints actually have joint fluid and are very similar to a knee or an elbow joint. And when arthritis affects these joints, individuals can have pain in their necks, their upper back, or even their low backs. Typically, people wake up in the morning with stiffness, or they have difficulty performing the same activity for a long period of time because of arthritis. How do we treat this? In the world of pain management, what we do is use a comprehensive approach. Medications, therapy, behavior modification, injections, and alternative treatments also have a role in managing spinal arthritis. When it comes to interventional techniques, there are few options to help people. One of these techniques involve X-ray guided injections into these joints. We have individuals assessed and then come to a room with an X-ray machine known as a fluoroscope. The procedures take anywhere from 3 to 10 minutes, but the whole duration may be a lot longer because of safety precautions. We do blood pressure, and these procedures are very simple and relatively safe. We lay individuals down on a table. Using a live X-ray machine, I will guide a needle into these facet joints. We put some steroid, which is a cortisone, known as either methylprednisolone or dexamethasone. And then individuals essentially have had a joint injection in their spine, or vertebral bones. That can help alleviate pain all the way from 3 months to a year to a lot longer, depending on how well they incorporate the comprehensive treatment program. Some individuals, though, have very severe arthritis. And in this case, there's not much room for the steroid to sit in these joints. In that case, individuals undergo a procedure known as a radiofrequency ablation. A radiofrequency ablation is a procedure where we initially test the little baby nerves known as medial branches. Now, these baby nerves run along the side of the facet joints. We do a medial branch block, again an X-ray guided procedure, where we go next to these nerves and put a little anesthetic. If individuals receive some pain relief, that gives us an indication that pain is coming from these arthritic or degenerated joints. The next step, after we confirm this fact, is to put needles into these nerves and use little probes, which heat up the nerves and dissolve the nerves. Now, by dissolving the nerves, we can provide anywhere from 6 months to even 2 years of relief in pain. And the nerves do grow back. It's a safe procedure. But when the individuals don't have this arthritic pain, they're able to function better, exercise more, improve function, and obtain benefit for a significant period of time. So facet-based treatments include the rhizotomy as well as facet injections, which could be very beneficial for people living in pain.